Did you know that up to 80% of African women will develop uterine fibroids by the age of 50? This staggering statistic highlights a silent epidemic affecting millions of women across the continent and the diaspora. Fibroids, while often benign, can have a profound impact on a woman's quality of life, affecting her physical health, emotional well-being, and reproductive journey. It's time to break the silence surrounding fibroids and empower women with knowledge, understanding, and access to proper care. This essay aims to shed light on the often misunderstood world of uterine fibroids, focusing specifically on their prevalence and impact on African women. We will delve into the causes, symptoms, and available support systems, aiming to equip you with the information you need to take control of your health and advocate for yourself or your loved ones. Uterine fibroids are non-cancerous tumors that grow within the muscular wall of the uterus. They are composed of smooth muscle cells and connective tissue, and can range in size from tiny seeds to large masses that can distort the shape of the uterus. While the exact cause of fibroids remains unknown, researchers believe that a complex interplay of genetic predisposition, hormonal fluctuations, and environmental factors contribute to their development. Fibroids are broadly classified into 4 main types based on their location within the uterus. Intramural fibroids. These are the most common type and grow within the muscular wall of the uterus. Subserosal fibroids. These fibroids grow outward from the uterus and may develop a stalk, becoming pedunculated fibroids. Submucosal fibroids. These fibroids grow into the uterine cavity and are more likely to cause heavy menstrual bleeding and fertility issues. Pedunculated fibroids. These fibroids grow on a stalk either inside or outside the uterus and can sometimes twist, causing severe pain. Understanding the different types of fibroids is crucial for determining the most effective treatment approach. While the exact cause of fibroids remains elusive, research suggests that several factors contribute to their development, particularly in African women. These include hormonal influence. Estrogen and progesterone, 2 hormones crucial for regulating the menstrual cycle and pregnancy, appear to play a significant role in fibroid growth. African women tend to have higher levels of estrogen exposure throughout their lifetime, starting with earlier onset of menstruation and potentially experiencing more menstrual cycles due to lower rates of contraceptive use. Genetic factors. Family history is a strong predictor of fibroid development. If your mother, sister, or grandmother has fibroids, you are at an increased risk. This genetic predisposition may be more pronounced in women of African descent. Lifestyle and diet. Emerging research suggests that lifestyle factors, including diet, exercise, and stress levels, can influence fibroid growth. Diets high in red meat and processed foods and low in fruits, vegetables, and fiber may increase the risk. Vitamin D deficiency. Studies have shown a correlation between vitamin D deficiency and an increased risk of fibroids, particularly in African American women. Limited sun exposure and darker skin pigmentation can contribute to lower vitamin D levels. It's important to remember that these factors are interconnected, and more research is needed to fully understand the complex interplay between genetics, environment, and lifestyle in fibroid development. Fibroids often present with a variety of symptoms, and the severity can vary greatly from woman to woman. Some women may experience mild or no symptoms, while others face debilitating pain and discomfort. Common symptoms experienced by African women include heavy menstrual bleeding. This is one of the most common and distressing symptoms of fibroids. Heavy bleeding can disrupt daily life, leading to anemia, fatigue, and social embarrassment. Severe pelvic pain. Fibroids can cause pain in the lower abdomen, back, and legs. This pain can be constant or intermittent, sharp or dull, and may worsen during menstruation. Frequent urination. Large fibroids can press on the bladder, increasing the urge to urinate even when the bladder is not full. This pressure can also lead to difficulty emptying the bladder completely. Painful intercourse. Fibroids, especially those located near the cervix, can make sexual intercourse painful or uncomfortable. Fertility issues. While most women with fibroids have no problems conceiving, certain types, particularly submucosal fibroids, can interfere with implantation and increase the risk of miscarriage or pregnancy complications. It's crucial to remember that these symptoms are not exclusive to fibroids and can indicate other underlying conditions. If you are experiencing any of these symptoms, it's essential to consult a healthcare professional for a proper diagnosis and to discuss appropriate treatment options. The impact of fibroids on African women is significant, both in terms of prevalence and severity of symptoms. Studies have shown that up to 80% of African women will develop fibroids by age 50, compared to 70% of white women. African American women are 2 to 3 times more likely to be diagnosed with fibroids than white women. Fibroids are the leading cause of hysterectomies in the United States, with African American women disproportionately affected. A study published in the American Journal of Obstetrics and Gynecology found that African American women with fibroids experience more severe symptoms and are more likely to seek treatment than white women. These statistics underscore the urgent need for increased awareness, research, and culturally sensitive healthcare approaches to address the disproportionate burden of fibroids on African women. If you have been diagnosed with fibroids, it's important to remember that you are not alone. Millions of women worldwide share your experience, and a wealth of resources and support systems are available to help you navigate this journey. Connecting with other women who understand your challenges can provide invaluable emotional support and practical advice. Numerous online forums, support groups, and advocacy organizations offer a safe space to share experiences, ask questions, and find solace in knowing that you are not alone in this journey. Living with fibroids can be challenging, but with the right information, support, and treatment plan, you can manage your symptoms and live a full and active life. Here are some empowering steps you can take. Educate yourself. Knowledge is power. The more you understand about fibroids, their causes, symptoms, and treatment options, the better equipped you'll be to make informed decisions about your health. Seek early diagnosis. Early detection and treatment can prevent complications and preserve your fertility. If you are experiencing any symptoms, don't hesitate to consult a healthcare professional. Explore treatment options. Various treatment options are available, ranging from watchful waiting to minimally invasive procedures and surgery. Discuss the risks and benefits of each option with your doctor to determine the best course of action for your individual needs. Adopt a holistic approach. Lifestyle modifications, including a healthy diet, regular exercise, stress management techniques, and adequate vitamin D intake, can play a significant role in managing symptoms and improving overall well-being. The high prevalence of fibroids in African women demands a collective effort to raise awareness, improve access to healthcare, and advocate for more research funding. We can all play a role in breaking the silence surrounding fibroids by starting conversations. Talk openly about fibroids with your friends, family, and community. The more we share our experiences, the less stigma and shame will surround this condition. Supporting research. Advocate for increased funding for research into the causes, prevention, and treatment of fibroids, particularly in African women. Empowering healthcare professionals. Encourage healthcare providers to receive culturally sensitive training to better understand and address the unique needs of African women with fibroids. By working together, we can empower African women with the knowledge, support, and resources they need to make informed decisions about their health and well-being. Next time, we'll discuss: why are fibroids so common in African women? The answer might surprise you. Don't miss it. Let's talk in the comments. Have you or someone you know struggled with fibroids? Share your story. We're here to support each other.